Hong Kong is struggling to cope as COVID-19 overwhelms the city. Healthcare is swamped and public services have been disrupted. Education is also at risk, with face-to-face classes to be suspended for another 2 weeks. There are more than 2,000 fresh cases, a new pandemic high. Another 4,500 suspected infections have also been identified. Vaccinations for young children are being ramped up as the outbreak spirals. Those aged between 3 and 5 will be able to receive the Sinovac vaccine from tomorrow. Deborah Wong with this report.
The rush to boost vaccination rates for children comes amid a spike in infections in the fifth wave. 4% of patients are aged 4 or younger. A 4-year-old died last week after testing preliminary positive, while a 3-year-old girl is in critical condition. The surge in cases among the younger age group is an unsurprising trend worldwide, as experts say children's low immunity makes them vulnerable to the highly transmissible Omicron variant. Aside from Sinovac, children aged 5 to 11 will be eligible for the BioNTech vaccine from Wednesday. One expert says parents he has spoken to are prepared to accept the jab, as the Omicron variant has affected children at a higher rate than the previous COVID-19 variants.
For the last 2 to 3 years, there are very little viral circulation in the community, and therefore, for that age group, they do not have what we call the cross-reactive protection from the other viruses that they will be exposed in the pre-COVID era. To a certain extent, would help reduce the severity. And of course, for young children, those very young, maybe 3 or 4 or even under that age category, their anatomy is such that they have very tiny little air tubes, and therefore if they've got an infection of the chests, then of course they would get into trouble much more than adults.
Hong Kong will reserve isolation facilities in hospitals for children, the elderly and those in critical condition, as the latest surge has overwhelmed the healthcare capacity. Authorities are hoping this arrangement will reduce the strain on hospitals. Occupancy for COVID-19 patients have hit 90%, and only less than 30% of isolation facilities are available.
The surge in the cases have forced the city to relook its isolation strategy. Up to recently, patients with little or no symptoms at all can recover in hospitals like these. But as hundreds of cases are flooding emergency departments, the situation has become quite untenable. Now, patients like these are being sent off to quarantine camps to recover, while close contacts can remain at home if they meet certain conditions. But home recovery, a common feature of endemicity, is unlikely to happen at the moment, as Hong Kong is still sticking firmly to its zero-COVID strategy.
But help is on the way. Mainland authorities have pledged over the weekend to boost Hong Kong's dire healthcare resources. It will send lab personnel, hospital beds, protective equipment and test kits to Hong Kong and ensure the smooth flow of fresh food supplies. But no timeline has been confirmed so far. Deborah Wong, CNA, Hong Kong.